Hi guys, it's Alicia. It has been almost 6 weeks since E-Day for me, so I wanted to give you a little update of how things have been going in my life with my new teeth and how my 10 mini implants are healing. I have 6 on the top, 4 on the bottom, and snap-in dentures, and I had 13 total extractions the day of my surgery. So it was a rough beginning, I will tell you that, but I have been going back for adjustments, and now that I'm here at 6 weeks, I have just about no pain, and I don't have the right bite. Like, everything is still off in there, and they can't really fix that without remaking them. So I do just have to live with that, and then just keep coming back for adjustments as my gums heal, so they can keep doing things to make them more comfortable until we make the new ones. So I'm hoping I can wait. Hopefully my gums will heal enough so that I'll be able to start that, and they won't change too much after that, because I want the permanent ones to have a real good chance of coming out perfect this time. That would be nice. Or maybe not perfect, but, you know, like pretty close to perfect, just at least symmetrical and, you know, not so many uneven bite issues and all the other things that I've been dealing with. So I can definitely empathize with anyone else that is going through a bad or poorly fitting dentures, or just cosmetically not what you want. I can relate 100% to that, because I wasn't expecting them to need so much work done right away. Like, you just don't expect that to happen. You expect them to be really what you want. But anyways, I'm about to be interrupted by one of these babies. Hungry. I will talk to everyone later. Okay, sorry. I had to switch my freaking device. So now I'm on my phone. Hopefully this is going to work. I'm going to have to edit some stuff together because I don't know what I'm doing. Anyways, I was saying, one weird, odd thing that I never would have known about dentures is that when I'm trying to make pasta and spaghetti and like macaroni noodles, I find it very hard to taste test them with my fake teeth. Like, I don't know why. Maybe it's because I didn't have back teeth for so long, and so when I would like chew the noodles, it would be mostly with my gums and my top teeth. So now it's just funny, like I have to get used to that. Noodles are like a weird texture with these teeth because you can't feel and sense texture or like temperature, so it's just different, something to get used to, I guess. But anyway, I've gotten a lot more used to these teeth. I look back at my video, like the day of surgery video, and it kind of makes me laugh when I watch it, because I was really pretty flustered and I was upset. I really had no idea, like, the process that you sometimes have to go through to wait for your teeth. I should have known from past experience. Like, I mean, I just know, even with like a breast augmentation, it takes about a year to get your final results to really be able to evaluate them and see, you know, the full everything after it's healed. So your teeth and your mouth are going to take a while to heal too. I was that naive going into this for some reason, even though I had a partial for 8 years before and I've had a lot of work done on the top. I just had no idea. Like, I thought it was kind of an immediate thing. I'm going to go and get my teeth pulled. I'm getting like beautiful, perfect teeth the same exact day. Easy peasy. Not really exactly like that, but I definitely don't feel like the girl with dentures. I don't feel like I had my teeth pulled. I don't really, like, it doesn't affect me. I don't know. I mean, the only way it does is if people know that I had it done and they ask me about it, and I'm pretty open. Like, I'm very open about it to anyone that's curious, just because it's an option for a lot of people, honestly. It's not bad. I'd rather have these, you know, nice teeth rather than my teeth that always hurt and kept breaking off. And like, I don't miss that, and I'm never going to miss that. So I'm never going to regret doing this. I'm really happy my teeth are gone, to be honest with you. So now I have these cool metal studs in my mouth. If like anyone ever wants to see them, I'm like, you want to see? I'll probably show you guys on camera. I will show you what it's like, what the teeth look like outside of my mouth at some point. I'm not going to do it today because I'm kind of just doing a little hurried update, even though that's not working, because now I'm going to have to edit some videos together because my iPad is full and I'm on my phone. I'll have to make that work, but I do have a camera and I'm planning to teach myself how to use the damn thing so that I can send the videos to my MacBook and then edit them and then hopefully have full screen videos on YouTube. But so for 6 weeks, I would say pain is all the way gone. The implants don't hurt. I can brush them with a toothbrush just fine. I can eat steak just fine. Like, I cut it, but I eat normal size bites. I feel like I'm eating my food faster now than I was before surgery because I didn't have all my teeth on the bottom. I had just the 6 in the front teeth on the bottom, and then I had all my top teeth only because I had a partial filling in some of the gaps. But yeah, going from that to this is like amazing. And I'm assuming, like, I'm going to get new ones made, but the rocking on the back, my lower one, I definitely have an issue with food getting up under there. And sometimes when I'm eating a certain way, like, my tongue might get up under the edge and flip it up more on one side, and then a food could get stuck in there. So that is not comfortable, and I think I could even use like the adhesives in there in the meantime, but I haven't asked my dentist, but I'd imagine I'd be able to do that. And I'd imagine that once I have my permanent ones, there will be no rocking, just like the top. The top is extremely stable and does not move at all. I mean, they feel like my own teeth when they're in there. I can't notice anything different about the top. That's awesome. So in the meantime, I guess I'm just looking forward to having them made the exact size and shape that they should be to fit my face, because I still feel like the bottom ones aren't really 100% right. I feel like they look a little, they're either, I don't even know. Like, I couldn't figure it out in the beginning. I can't now. I'm getting more used to them, but I don't feel like they look right. And I definitely hope they can fix the color in between them, like where the gum tissue shows. I feel like it's too dark. And I feel like it goes too far down almost. Otherwise, they're really pretty. There's a couple spots where it looks like there's plaque in there. And it's not. It's just the way they're made. I don't know if you can see it. But this is how they look. They're crooked, like this one's lower. But that's how they look. This is my left side that I usually prefer. Now, it's got the pointed canine. I don't know if anyone else is like this, but I feel like I just noticed recently that I don't very often take pictures like straight ahead. I don't know why. Maybe I will be able to more like once I feel like things are symmetrical, but like I usually just, I'm so used to doing it from one side, because when I had my partial, you could really tell that I had metal up in my mouth from the partial. So I'd always like smile from a certain angle so you couldn't see that. So it's like subconscious, you know, and I've seen other people say it's hard to even remember how to learn how to smile. For that, I recommend watching a lot of comedy and funny movies, because you gotta smile and you have to laugh. And I know personally, if I had to have gone without my teeth and I was not expecting that to happen, like if that had happened to me and like for some reason this failed and I'm just gonna have to wait for a few months with no teeth, I think I'd probably take it really hard, to be honest, especially for anyone that's not expecting that. But I do think it's important to remember that that could happen. Or like they could break at one point and not go back in your mouth. Like I've seen that happen to people too. So I'm just really grateful right now that I have teeth that work, that I can use, that I'm happy with, that I can smile with, and I'm laughing with. And I'm not hiding like too much. I feel like I don't have to hide them. But I am still so excited to get the permanent ones and to have that done. I just want to give myself enough time now to heal the right way, so I don't have to worry and deal with like the same kind of fit, you know, when your gums adjust. You just have to give it time. And I didn't realize how much time, I guess. It should be common sense. I mean, but I'm just that kind of person. Like sometimes I don't realize it, I guess. Like I just didn't realize how much time it could take to get your denture to fit right. I didn't even know that. I thought it was normal for them to just fit. I guess. I mean, when I got my partial, it just fit. I didn't ever have a temporary partial, and the one I had always fit perfect. So I was very lucky in that regard too, because I've seen other people have problems with them. Although my partial was mostly metal, it wasn't a full acrylic partial, so maybe that had something to do with it. So it was like anchored onto a couple of my teeth. But yeah, taking these in and out now is extremely easy. I just take them in and out. Every time I eat now, I can just pop them out, rinse them, pop them back in, all good to go. No issues other than when one gets stuck on an implant. If I take them off at the wrong angle or put them back on like funny, they can be like that. And I guess the O-rings can loosen up over time, and you have to pay about $100 every year, he said, to replace the O-rings so that they stay tight. So I'm sure you want them to be tight. Just in the beginning when I was healing, they were so tight and hard to remove. It was probably because my gums were swollen. So it's swollen around the implant, and then you're trying to hook that into the, you know, top and bottom partial, or not partial, the top and bottom dentures. So it's kind of difficult to remove them when you're swollen like that. And I didn't even think about that until after. Now that I realize how much my gums have settled down, I'm like, well, geez, like that's probably why they weren't coming out. Like it was all real tight in there. Now I can tell how loose it is and how my gums have really settled a lot, especially on the bottom. So I don't go back for a few weeks. I go back, I think, in mid-July. I don't know if that's when I will start the impressions, but hopefully I'll get some questions answered. I feel like it just depends who I see. Sometimes I see the other dentist who doesn't really own the whole place, but when I see Dr. Shatkins, I can ask him directly any questions that I have and make sure the next few steps in the process are going to go like how I'm hoping, and hoping I get to pick the shape and the color and, you know, a lot of stuff. Like, I don't know, we'll see. And the gums, like, I'm definitely hoping they can adjust some of the gum color, make it lighter, and just make it not get so dark right between the teeth, for whatever reason that is. I think even if I picked a different shape of teeth, they might not look like that at the gum line. So I really don't know about that. We'll see. I am eating like myself, pretty much eat whatever I did beforehand. I don't eat corn on the cob, like off the cob yet, but I can eat things like hot dogs. I can eat big BLT, like on toasted buns and subs. I can eat those. Those are soft enough. I still kind of use the side teeth. I don't really bite with the front teeth. I have tried to do that, but the last time I tried to bite something with my front teeth, I don't remember what it was, but it was something kind of hard, like maybe it was corn on the cob. But the last time I tried to do it, I got a jolt of pain, like in the bottom implant. It just really like pushed down hard on one implant and kind of hurt. So I'm not going to be trying to do that for another few weeks. But they are pretty much healed. I feel like, back to myself, I feel like I'm trying to think of updates to give you guys, but really that's all that's going on. Just waiting for healing, waiting to go back to my next appointment, to when I can start picking out the next, like, things in this, the next process or whatever, you know. So I'm just going to be patient. I'm very happy I'm not in pain, and I feel great. I'm really happy I did this for myself. It feels amazing to not have to hide my teeth when I talk. I still notice I have this little whistle sound sometimes, like I don't know, it's like, I'm not really sure where that's coming from, but I've heard other people, like in the groups, they say if you want to practice your speech after dentures, to sing in the car. So I might start doing that. I haven't really tried, but that would be fun. We'll see if that helps. I don't know. It seems like some days are different than others. Some days my speech feels back to normal, and then other days it sounds more whistly, I guess. And even just after an adjustment or something, it can change quite a bit of things. That's what happened after he adjusted it this last time. But now, since they kind of shaved half, like on the top, he shaved off half of one side down to the gum line, but left them longer on the outside. So when I smile, they look the same, like the normal size teeth. It's kind of hard to explain, but because my jaw's out of alignment now, when I'm chewing, sometimes my cheek gets pinched, like right in there. Only on this side when I'm eating. I'm not sure why. So I still kind of I have a preference for the left. I chew with my left more than the right. And I was thinking the other day, I wonder if that has anything to do, or if that has any effect on your healing and your gums. Like, if by chewing on one side primarily, is that making my gums tougher on that side, or will it make them like settle down faster or slower? You know, I don't know. Those are all things I could ask my dentist, but let me think, what else is there to say? I think that's about it, really. I'm feeling good. I'm trying to learn. Well, it's the end of the school year for my 4 kids, so it kind of makes it hard for me to sit down and have 10 minutes even to get my thoughts together. So I'm going to be working on all that, and we're wrapping up all the end of the year stuff, so I've been extremely busy. But once we get done with like this week and all the end of these sports and dance recitals and all that, I should have more time to learn my camera and my MacBook and be able to make some more videos, because I have so many topics that I really want to talk about. Like, I don't know, even just emotions in general and how this affects me as a woman and what you could expect, and like, I don't know, I just have a lot of ideas. And I want to do a video about how my surgery day went, so I can give other people an idea of what to expect if you're having a similar situation, and like all in one day type thing done. That would be beneficial to know how it went for me. And yeah, I think other than that, that's about it. So thank you guys for listening to me ramble. I really hope that I don't have too much to edit, so I can just upload this straight up on, or whatever. But we'll see. I'll be working on it. I'm sorry if the lighting or quality sucks. I'm just using what I got. So this is the best that it gets for right now. But I appreciate everybody for watching, and everyone's comments, everyone who's been so supportive in all the groups and everything. Like, I can't thank you enough. You guys really make me feel like, you just make me feel good, you know? And I hope I can be just as encouraging to other people that are watching going through this. Like, it definitely gets better. It's only been about 5-6 weeks for me. I don't even feel like I just had surgery. I feel like myself. I'm enjoying my life. Like, I can't wait to not have to worry about any of it as soon as they're permanent. You know, I'm done. Like, good. You know, as long as everything keeps going good. No complications. Implants are doing great. I'm doing great. Eating normal. Nothing bothers my mouth to eat. And I don't wake up sore in the morning anymore either. So there's like literally no pain. It's so freaking worth it, I'm telling you. If you're thinking about doing this and you have good reason to do it, just go for it. If you can do it, do it. I would recommend it, especially if you're thinking about implants. If you don't want to get like the traditional size, consider the minis, and I would definitely consider doing the lowers, if not both. But if you can only pick one or the other, do the lowers, because the top ones almost always stay in better. Not always, but from what I've seen, even like just the traditional dentures, they usually stay better on the top because they have the suction working for them. But in general, uppers are a lot more comfortable and easy to get used to. So yes, I'm very glad I did it. Happy I did the implants, especially on the bottom. I can't wait until my bottom teeth look how I want them to. But anyways, if you're enjoying my videos and me rambling and want to see what happens next and follow my updates for when I get these done and this revision, and see what else I end up talking about on this channel, I guess, then please subscribe and let me know what else you'd like to hear me talk about or show you in the next videos. But anyways, thank you. Hope everyone has an amazing beginning of summer, and take care.